Welcome to NP's Changing Practice. I am Dr. Carol Berger, and we have Dr. Dawn Garzon with us today, and I am so excited to have her. She has so many accomplishments, it's kind of hard to summarize them, Dawn. You're a pediatric nurse practitioner, you're a mental health specialist in pediatrics, you're an expert in the development, behavioral, and mental health arena, and you have been the author of multiple publications, to include the lead author of the 7th edition of the, how do I pronounce that? It's the
Burns Pediatric
Burns
Primary Care.
publication. Yeah, Burns Pediatric Primary Care, and that's put out by Elsevier. You've been the president of NAPNAP, which is huge in the pediatric world. You've served on multiple committees at the state and federal level, making a difference for our pediatric population. And personally, I know you, and you made a difference in my life because Dawn was my teacher. And I am proud to say that because I don't remember all of my teachers, but I remember you. And you taught me things that made a difference in my life and helped me identify children and get them the help they needed right away rather than floundering and not knowing what to do. So I am so excited that you are with us tonight. And I'm anxious to hear what you would say. What would you say to NP students that are, just starting this journey? How can they really make a difference?
Well, I think whenever I talk to students, one of the things that I say pretty early on is to learn to enjoy the process. I think we live in a world that we all feel like it's got to happen in the next 5 seconds or it doesn't count. And if you would talk to, I've been an NP since 1994. So if you would talk to me in 1993 about what I would be doing with my career, and if I would never have mentioned mental health because I hated psych. Like, are you kidding me? Like, I never in a million years would have imagined going there. And I think as a student, what I thought my career was going to be like and what it ended up doing are very different things. And I think that's really more the rule than the exception. And that's one of the
You're
beauties of nursing, in that as we grow, we have life experiences that pull us into a certain direction, or new things pop up and we get excited about new methodologies or new ways of treating people.
opportunities.
Absolutely. And so, what I would say is know yourself, know, keep yourself, you've got to be involved, join organizations. And this is where I sound like the old maid, but young people don't join organizations the way that we used to. And organizations like the American Association of Nurse Practitioners, or NAPNAP if you work for children, or APNA if you work with psychiatric patients, or ENA if you're an emergency nurse. These are the organizations that are doing the lobbying at the federal level to get legislation passed that affects our practice on a day-to-day basis. They're the ones that are making the connections with CMS to make sure that funding is there. They're the ones that are creating the blueprints for us to do the policy work that affects us day in, day out.
Absolutely.
And when
We
you're
had Margaret Barton on the first show, and she was telling us the legislation that's going through right now that could affect whether we can call ourselves doctor or not.
Mhm. And I think, when I was a student, and shoot, if you'd talked to me 10 years ago, I would have gone, oh, policy, and I don't do that. I hate politicians. I hate everything about politicians. I'm a very plain spoken person. Kind of what you see is what you get. And I see you nodding your head because you know that. Um, but policy and advocacy has become a huge part of what kind of I'm interested in, because you can only make so much of a difference in your own little world. So you have to get involved. These organizations not only will advocate for you, but they'll also make sure that you have access to journals and information so that you stay up to date. Because when you're not in school, you're not going to have a Dr. Berger standing over you going, there's a new clinical practice guideline coming out, or
Yeah.
there's a new antibiotic that just came out. And how are you going to learn about it?
Or hey,
Are you going to learn about
how
it?
our scope of practice has changed. You know?
Exactly.
I mean,
And, I see too many people that are like, well, I learned because the drug reps told me. Well, that's like learning about your health from watching commercials on TV. Like
Dr. Google.
exactly. And so I would say know yourself. Don't worry about getting there in the next 15 seconds, because as a student, you haven't even started the race and it's a marathon. So like, don't go too fast out the gate, or you'll drop dead of exhaustion 2 miles in and you'll never get there. Know yourself, know what it is that you like and what you don't like. What are your negotiables and your non-negotiables? So you don't take a job after graduation if you need benefits that doesn't have benefits, or that, like, I don't want to deal with old people ever under any circumstance ever.
Not
Like,
even me.
socially, well, and I am one, but like socially I enjoy it, but I don't want to take care of them.
Yeah.
And so for me, taking a job that would require going into nursing homes would be like torture. And then
Mhm.
get involved in organizations like Mona and like your professional organizations. It's such a small amount of money when you look at it based on what we spend at Starbucks every month. And
Well, and
Starbucks isn't tax deductible.
if we look at the medical association, they've really got that sewn up. I mean, they do get involved. And
Yep.
I would say, I don't know if you would agree, but I would say that nurse practitioners, there's more of us. I'm
Well,
not 100% sure, but if we all join together, we could be a strong voice.
well, and we are, so I think AANP, if I remember correctly, has something like 100,000 members, but there are 260,000 nurse practitioners.
Right.
NAPNAP, the last time I heard, has a membership around 9,000, and there are about 16,000 pediatric NPs or 20,000
50%.
NPs. So it's like, it's less than 50%, right? And, and then NAPNAP isn't just for pediatric NPs. If you're a family NP and you're seeing kids, you're welcome there.
Yeah, that's true.
And so, the majority of us don't get involved. And some of the most rewarding experiences, like mind-blowing experiences in my life, have been because I got involved. And you get involved and
Tell
meet.
us about some of those. Tell us something about, where you were happiest when you made a real difference. Because I think they also don't think, what am I going to really do? I'm not going to be able to make a difference, but you have. How did
Well,
that
I,
happen?
I hope that I have at the end of the day. I don't know that I can claim that, but like, when I was president of NAPNAP, I came off the board last summer. The big issue that was going on as I became president was the separation of children at the border. And I'm a mental health specialist. I know what adverse childhood experiences, I know what trauma does to children. And I know that that's not who we are as Americans, and that I wasn't happy with my government doing it. And so I used my platform as president to speak about it. And I have sat in rooms with senators with only a couple of aides, talking about what we need to do to have changes to this policy. I've sat in the room with attorneys from the General Accounting Office that are
Wow.
doing audits, and I trip over things that don't exist. I'm not all that in a bag of barbecue potato chips, but yet I was in a position that I could use my platform to
Advocate.
influence things positively for other people. You mentioned the textbook that I'm involved with, and most students who have a PEDS textbook in their NP program use our book.
That makes a huge difference.
And I got involved in that because I was at a conference and the lead author, Kathy Burns, was in a booth, and I went up to her and I went, "Oh my gosh, you're my Shiro. Like, I just love your book." And like, I was fawning all over her. Like, and it's funny looking back on it. And she asked me to help with something. And I went, okay. And I went home and I rolled up my sleeves and I did it. And I did such a good job that they invited me to do another project and another project. And so,
The kind of mushroomed.
right. At NAPNAP, I started on a committee. I started on the continuing education committee. I had one meeting a quarter. I probably put 4 hours a month into it. And it opened doors and it gave me opportunities to meet other people. And now I have a national network of
And
people that I
that's
can pick up
amazing,
the phone and
isn't it?
call, you know. And I'm no Doug Bolden, right? I'm no Chris Hemmer. I'm
I think that they would say they're no Don Garzon. They would say they were taught from the best, right? Or were
that
with
just makes
the
me
best.
old.
No, no, because I went to school old.
There you
I was
go.
one of your oldest students, right?
Well, I think the funny thing is I lived on the West Coast for a while and I've just moved back, but I had a patient come in once into the urgent care, and I was talking to her about her kid and I was educating her about her kids, and she goes, "Wait a second. I think you were my," and she used the wrong term. She goes, "I think you were my pediatrician when I was a kid." And I went, "Oh God."
And that does creep up on us, doesn't it? Because when I started taking care of the children of some of the children that were like, when I first went out to rural health, they were,
Yeah,
young 20s, and then their children somehow turned 7 or 8, and I'm going, how did this happen? Right.
exactly.
But as you're sitting here talking, about networking, I'm sitting here thinking, my project is to try to get money for, more money into oral health for kids, especially
Mhm.
and it's really, really hard because Medicaid pays 50% of what a provider does. But I'm thinking, you've got connections. So, I mean, we'll talk later, but I'm just saying that what you're talking about is building networks. And as an NP, you can build more networks than you would believe.
Absolutely. So when I was on the West Coast, my senator was Senator Patty Murray, who's in charge of, was the minority leader of the Health and Human Services Committee. Um, and I would go when AANP had lobby days, and I would reach out, and I met her aides, and I had her aide. I still have a stack on my desk. These are all
Of your
congressional aides,
cards. Yeah.
because if you want to get stuff done, you
You go.
sell the aides. They're the ones who write the laws,
Right,
right?
right,
And
right.
so, you guys should know who is your representative, who is your senator, who's your state senator, who's your state representative. And when stuff goes on that you're happy about, pick up the phone and call them and say, I noticed that there was a vote yesterday on issues of whatever you're passionate about.
Yeah,
I mean,
right, right,
I'm very passionate about improving access to people that traditionally don't have great access. So I
right.
I am one of those people that believes in Medicare expansion.
Mhm.
And so when I see votes that happen, I pick up the phone and say thank you. Or if they don't, I'm on the phone. And it's so funny because it started small. It started me in my house, like sending an email. And like literally my senator from my state, their aides knew my voice. They'd be like, "Oh, Dawn, I knew you'd be giving me a call. I knew this." And then what happened, because they knew me, when something would come up, because they're not healthcare people, they understand healthcare
They
from
reached out
watching
to you.
Grey's Anatomy,
Yeah,
right? So
yeah.
when something would come up, they would reach out and they would call me and they'd say, "So tell me what you think about this."
That's amazing. Because you
And it
didn't
just
realize
starts by
that would
building
happen.
relationships. Yeah.
Right.
And you can do that as a student because you're a nurse.
Right.
And like right now, everybody always loves nurses, but right now everybody really loves nurses. There's a lot of
We
power
really,
to having that.
yeah, we
And
really do.
picking up the phone and saying, I'm a nurse and I live in your district and I like the work that you're doing, or I'm a nurse and I live in your district and this, you did this and I don't like it. And here's why I don't like it. Because they don't think about how those decisions are going to end up directly affecting people's lives. And I would tell them, anytime you want to come to my office and see what my day looks like and see how your constituents are actually living, let me know. You can come in anytime.
Well, and I think Margaret Barton brought up a really good point too, and this is a good example. One of the laws that was going through would prevent NPs from being able to do any type of surgery, but surgery is very ill-defined. So surgery would include stitches, biopsies.
Well,
And there again, wow, how much of that do we do in an urgent care? Now you have to have a sutures only by a doctor, or I mean, that's something that would be a big, huge access of care issue, especially as you get in more rural areas.
well, I mean, I practiced in Missouri for 20 years and then I moved out and I was licensed in Oregon and Washington because I lived on the border. And I was the only pediatric prescriber for a federally qualified health center for behavioral health for kids. We had multiple providers that did adults, but I was the only one who did kids, especially kids under 12. And after practicing in Missouri for 20 years, both Oregon and Washington had independent practice.
Wow.
So I showed up, I got credentialed, and now that I'm back, I have to play like I can give a kid Zyprexa.
Right,
I
right.
want to give them Ritalin.
Ritalin, you
I
can't
have
do
to
that.
send them to a
I
psychiatrist to
know.
verify that. And the insanity of the opioid crisis that we have in Missouri was not created by us.
No, no, and
And it
they're
certainly wasn't nurse
strong data
practitioners
for
that
that.
are trying to take care of kids that have ADHD.
Right, absolutely. I
And
mean,
so,
great,
you know, it is one of the things after having had independent practice for 4 years that I come back and I just go, like, seriously, seriously,
right.
seriously.
Yeah, and I mean, you're in a very a unique specialty because taking care of children under the age of 12, for most of us, is scary. When I think of, oh no, what do I need to give a child, in primary care if I can't get them in to see somebody for a while and they're severely depressed and they're like, 10. I'm scared of what to pick necessarily. I'm not real comfortable there. So you're in a great position to advocate for, and we have a ton of psychiatric nurse practitioners now that are going through the program. It is a
Mhm.
program that is exploding, and I'm so hopeful that they will consider the child as
Well,
one of
and
the
I'm
specialties.
actually, yeah, I'm in Mizzou's program. I'm going back after all of these years to get my psych NP. Um, but I think it, mm, anytime I'm very worried that the move to the psych NP as a lifespan decision, the overwhelming majority of people don't deal with children under 13.
Right, right.
And just like most FNPs never touch a kid again after they leave their program,
Some don't. Yeah, yeah. I would have to think
most
that most
don't.
don't. Yeah,
Most of them don't.
yeah.
And if you only see one kid a week, are you really going to pick up on a nuance of a bad thing
Right.
when you only do it one day a week?
Oh, it's just like
And
you
so,
only super once every 6 months. What's going to
right,
happen?
right. And so
know?
child health and wellness is my passion. And I believe that seriously ill children deserve a right to a specialist that is a child developmentally grounded
Absolutely.
specialist. Um, and and I'm glad you have a ton of students in the psych program. Suicide is the #2 cause of death for 10 to 34-year-olds in the United States. And
Wow.
if you live in Alaska or Utah, it's #1.
Wow.
So we lose more children and young adults to suicide than we do to COVID and heart disease and cancer combined.
Wow. That's
So,
huge.
our children are dying of mental illness in epidemic numbers. And we still have so much social stigma about, we don't think twice about taking metformin and eating Entenmann's for breakfast, but God forbid somebody needs Zoloft and what you're cheating.
Right.
We put poison in our veins when we have cancer to get better, but fixing somebody's neurochemistry when they're dying of mental illness is
Right.
a character flaw. So
Well, we're seeing
I
more
love
autism.
that you have huge numbers of psych NP people. I just hope, my fear is I see a lot of young people going in because they like the salaries and they think they'll get a job. And that goes back to that mistake of, you've got to keep the long game in mind, because as NPs, in the 30 years I've been an NP, I've watched NPs get laid off, and I've watched there be 5 jobs for every student when they graduated, and it fluctuates. And if you're spending your time making a career long, like, physicians don't decide where they do their residency based on who's hiring today, but nurses do that all the time.
Yeah, that's true.
So think about it. If you are in a family nurse practitioner program and you never want to touch a child, why are you not in an adult program?
Well, and that's a really good point. That is
And if
because
you know you want to work with children, why are you getting a generalist degree? Why aren't you specializing in pediatrics? Well, because
right.
I knew somebody at this hospital and they got laid off once for 2 months. Anybody can get laid off for 2 months at
And you
any
have
point.
to follow your passion because you know what you love to do.
You can't follow what and everybody goes, well, I am a ABC nurse because that's the system I work for. There's a whole healthcare system out there that has nothing to do with ABC. So just because ABC is doing this right now doesn't mean that in 6 months somebody wearing a tie isn't going to decide that they don't want that anymore and they want this over here. And now you've gone to school and you've gotten a degree and now you're doing what I'm doing 30 years in. I mean, I've been working in this space for 15 years and now I'm having to go back to school to get a postgraduate certificate to be eligible to sit for the boards to take care of the really sick kids that are out of my scope.
Right.
Know your scope
Know what you want to do.
and know your scope. I don't care that, like, I was on Interstate 70 today and I was going 15 miles an hour over the speed limit and everybody was passing me like I was standing still. And you know what? If I had got pulled over by a cop, would I have said, well, everybody was going 80? No, you need to know what the speed limit
What
is.
it
And
is.
nurses and nurse practitioners, well, I got hired as an FNP with a psychiatrist to see psychotic patients. That's out of your scope. Know your
Right.
scope. Know the APRN consensus model. Know what your Nurse Practice Act says. Don't listen to what your friend says, because your friend might not know. It's your job to read the Practice Act. It's your job to know the laws.
Right. And you do have to know the scope that you want to, what you're able to take care of.
Yep.
Where your limits are. And I think in the beginning, because I've been in NP now 12 years, and I think the first job I got that was offered to me was an acute care practice, in acute care. Well, I hadn't been trained in acute care, so there was a big learning curve. I call it my residency. But, there was a huge learning curve because I hadn't really had that kind of training. And looking back on it, they didn't offer acute care practitioner practitioner at that point now. And I am much more comfortable in the FNP role in that rural clinic where I had, and we had about 50% of each, you know, I mean, we took care of the whole family. And that was really, really an honor, because you really got to know the family. You made a difference in people's lives. I would say, you know, for me as an NP, that's been I haven't been able to do much legislatively yet, but I'm trying. But I really have enjoyed becoming a member of people's family as their provider. And I mean, not like real, but I mean, feeling like you knew the grandpa and the mother and the kids and the family dynamics. And one of the things I keep telling nurse practitioners is there is not non-compliant patients. I don't like the word non-compliant, and there's not non-compliant kids. You know, I mean, we have an agenda. If you told me, and I probably do need to stop drinking Pepsi. That's probably something I need to stop doing, because I go to that 7-Eleven twice a day and I get my big gulp, and that's how I function. You know, and if you told me I had to give that up, that would really be, I would probably nod and say, sure, Dawn, I'll do that. That's good, you know, and I'll go and be non-compliant because it's not one of my goals, not right now.
And that's just human behavior. Every significant chronic disease from a public health standpoint is rooted in the fact that human behavior is not about knowledge. It's
right.
complex than that. And what do we do as nurses? Oh, I'll just go in and teach them.
That's right. And we'll do teach back.
You're smoking. There's no way in hell in 2021 that you don't know it's killing you.
I know.
I'm fat. I know I'm fat. I've seen myself naked. Someone coming in and telling me that I'm overweight
is not
going to make me get thin.
And all we have to do is eat this kind of food and we'll fix it all, right?
Right?
Yeah, that's not
So
it.
It's the insanity of, and frankly, the paternalistic, I'm superior than you are.
Yes.
That
yes.
I'm the great.
You'll do what I tell you to do because
I'm the great keeper of knowledge. You should listen to me and my knowledge.
Right.
And if you just listen to me, then your life would be better. Well, frankly, who the heck are you to tell me how to live my life?
Kind of, you know, I always tell the students, does that work with your teenagers? You know,
I think back to my dad was an absolute medical train wreck for the last 15 years of his life. And he was in and out of the hospital. He had procedures that I'm pretty sure we met surgeons that would open a rock if they had the opportunity to do so. And everybody kept saying, you know, you just need to do this and you just need to do that. And my dad loved red wine. He loved red wine. And he looked at me and he goes, I'm 78 years old. If drinking red wine is going to make me live 5 years less, and I'm going to enjoy those 5 years.
Yeah.
You know, and I think we had this whole thing of like, when I was a nurse, people routinely died. When I first became a nurse in 1990, people routinely died in their early 70s. Mm-hmm. Now we say if you died at 80, that you died young.
Yeah. Yeah. True.
And what is the quality of life of people for the last, it's why I don't do adult health. Right. Because I find the way we medically torture our older people in society very difficult for me ethically to deal with. That it's all about quantity of life, and no one's looking at quality of life anywhere.
But we can say that to our patients. Those were
can.
I did say
absolutely.
I would sit there and I would say, what is going to bring you joy? What is going to make your life meaningful? And then, how can I help you achieve the goals you want to achieve?
Well, and there's so many ways of, SMART goals that we all learn in our nursing program. You can do brief motivational interviewing, but it's every single one of us has negative habits.
Mhm.
Every single one of us.
Yeah,
Anyone who's going to hear this has at least 10 things related to their health that they could do better.
yeah, I would
And
agree.
ask yourself why you don't.
Yeah, and that's what
And
that
then why do you think walking into your room with a patient and saying, "Hey, Dawn, you're fat," all that's going to do is make me lose confidence in you as a healthcare provider.
right, right. Rather than saying, "Hey, Dawn, what can I help you with? What are your goals? What do you want to achieve?"
Right.
That's a whole different approach. And I
It's a
say
whole different approach.
it
And
really
if you
needs to be
do
patient
walk
centered.
in, if you do walk in going with like I have kids all the time, and it was much more of an issue on the West Coast than it is here in Missouri, or they're just lying to me more. But weed is legal out there, and so many
Right,
people were
right,
using it because it's legal in Oregon and Washington. And so they'd come in and I'd be like, okay, so they're smoking and they're vaping and they're using weed and they're drinking. And I'd say, I'm not going to give you any lip about smoking right now. Go ahead and vape. And they'd look at me like I was crazy. And I'm like, because right now your alcohol and your marijuana use is a bigger problem
right.
to
Yeah,
your mental health and your developing brain. If we can
right.
get you healthy, then I can nag you about the vaping later on. And if
But for
frankly,
right
if the
now, yeah,
nicotine kicks you up,
right,
go ahead. Like, I'm not going to give you lip about that right now.
right.
And if I asked everyone who hears this to bend over and pick up 150-pound weight, the overwhelming majority of us might give ourselves a hernia, but we would never get it off the ground. But if I asked you to
That's
pick
what I'm
up,
thinking. I
if
don't
I
think that
asked
would
you to,
work.
if I asked you to pick up a 5-pound weight, you would.
Yeah, yeah, yeah,
And
yeah.
so, we don't tell people he need to lose 100 pounds to lose 100 pounds. We set maybe a goal of a
A five.
5% body weight because the evidence shows that that will improve their quality of life, their blood sugar control, their adiposity, their lipid levels, whatever. And so maybe they lose 15 pounds. And then at that point, you talk about the next one. Or
Right,
maybe they lose 20 pounds. Or if they're smoking, you don't tell them to quit cold turkey. You tell them to get rid of one cigarette every 3 days.
right. Yeah. Well, and I mean, maybe if they've got two bad habits, we can't stop, like you said, both things at the same
You
time.
know, it's the thing that we all do on January 1st, right?
Right.
I'm not gonna drink as much. I'm gonna walk more.
I'll
I'm
lose
not gonna
20
be
pounds.
stressed. I'm gonna spend more time with my family. I'm gonna eat better and I'm gonna exercise more. And we get to January 15th and we're sitting on the sofa eating Jen and Barry's out of a container while drinking a margarita because we put too much on our
Much
plate.
on our plate.
And then what happens is we start failing. And as students, think about how you feel when you feel like you're failing, when you get a bad grade on an assignment, whatever.
Right.
Bad might be a
Or
90,
you're at that
but
point where you might need to withdraw,
absolutely.
you
And
know?
think about how you feel about yourself. Well, why am I going to continue to do this
If
if
I'm
I'm
not
failing at it?
right,
If I don't try to lose weight, then I'm not failing when I don't do it.
right. Right, right. You bring up so many good points. And Dawn, we are so blessed to have you. We
I
really
know I've been all over the place tonight. So for anybody who made it this far, thanks for sticking around.
no, but you really have. You have really, and I want to have you back again. Now, maybe later on in the year, talk about some other things. But I know the students and nurse practitioners out there that hear what your message are going to be inspired. And so I'd say our takeaway is join organizations, get involved. No,
Long game.
yeah, don't expect to get there all in one time. Pace yourself and take it and try to do some self-reflection on what motivates you
Hmm.
to be able to do things, and think of how can you turn that around to help support a patient through whatever changes they want to make. And you know what? My bottom message is sometimes you might have that 78-year-old who wants to just drink his wine, and he's going to die 3 years earlier, and it's okay.
And I think fundamentally, and the takeaway is that our job as nurses is to meet patients where they are, not where we want them to be.
I love that. We need to put that on a t-shirt.
Meet them where they are.
Meet them where they are, and follow along with their journey, and try to help where you can help and lift where you can lift. And also, if they fail and they say, I'm going to lose 10 pounds, and they come in for that next visit and they gain 15, that's not the time to lecture.
You should never lecture anybody.
Ever.
Who has ever been lectured about their bad behavior and actually did
And
something?
changed it. Yeah, and changed it.
But if I said to you, so let's talk about it. What happened?
Right.
Let's talk. Tell me about it. That's one of my favorite things is tell me about that. Tell me more about that. What happened?
Mhm.
How's
Yeah, and
that
how
working for you? How's
Yeah.
that working for you is a great question. How's that working for you?
Because
Because if it's not very well, well, then maybe they'll realize that if they want to do that, they got to do something different.
Right. I like that. I like that.
And just remember that if you've got 12 things that you don't take care of, and you know what you know, and they're not in healthcare and they haven't seen what we've seen, glass houses, people. We live in glass houses.
We do. And we want them to come to us because they know we care.
Well, and as nurses, that's the thing, is they tell us, study after study, that they understood more about their disease, or they understood their medications, or they felt listened to. They didn't feel like somebody walked in, threw a prescription, and ran out of the room.
We weren't treating disease. We were talking to a person.
That's because we're nurses.
That's right. And that's what nurse practitioners bring to the table.
When people ask me what I do, I say I'm a nurse. Because that's the core of who I am. And so thanks for having me.
Thank you for coming so much. Thank you all for listening to NP's Changing Practice, and stay tuned. Listen to this podcast and stay tuned for the next one. So we'll see you. Thank you so much, Dawn, and we'll get together again. Okay.
Good.
All right.
I promise I'll be a little more put together next time.